Hey, thanks for making it to Veterans Info Tap. Glad you made it today. Today I wanted to talk to you about VA priority groups. Now, this is specifically within the Veterans Health Administration. So when you start to go get care at the VA medical center or outpatient clinic or wherever, they have you individually placed into different buckets, different priority groups. And so that's what I wanted to talk about today, was go through those priority groups so you understand what priority group you fall into and why. So with that, let's go ahead and jump into it. I have my laptop opened up here so I can just read off of this for you on this specifically. All right, so VA priority groups. It says here, what are VA priority groups and how do they affect me? When you apply for VA healthcare, we'll assign you to one of 8 priority groups. So there's 8 priority groups. This system helps to make sure that veterans who need care right away can get signed up quickly. It also helps to make sure we can provide high quality care to all veterans enrolled in VA healthcare program. All right. So it's a sliding scale, 1 to 8, and you're either going to be seen faster or slower, depending on where you fall. Your priority group may affect how soon we sign you up for healthcare benefits and how much, if anything, you'll have to pay toward the cost of your care. So in other words, copays. What factors will VA use to assign me to a priority group? We'll base your priority group on your military service history and your disability rating and your income level, whether or not you qualify for Medicaid, and other benefits you may be receiving, like VA pension benefits. We assign veterans with service-connected disabilities to the highest priority. We assign the lowest priority to veterans who earn a high income and who don't have any service-connected disabilities qualifying them for disability compensation, monthly compensation payments. So that last part's really important. You can make $1 million a year, but if you have service connections for conditions, it's going to raise your priority group. And the other way, you can make $1 million a year, and if you don't have any service connections, then you're going to be lower, right? Because they're basing off your service connections more than your income, is what they're talking about in that little blurb. So priority group 1, we may assign you to priority group 1 if any of these descriptions are true. You have a service-connected disability that we've rated at 50% or more disabling. Or you have a service-connected disability that we've concluded makes you unable to work or be unemployable, right? So TDIU. You've received the Medal of Honor. Okay, so that's your priority group 1. 50% or more, TDIU, or Medal of Honor. Priority group 2, we may assign you to priority group 2 if you have a service-connected disability that we've rated between 30 and 40% disabling. Priority group 3, we may assign you to priority group 3 if any of these descriptions are true. You're a former POW, you've received a Purple Heart, and let me look, priority group 3, if you're a POW or a Purple Heart recipient, don't you think that you should probably go get service-connected for your conditions, and those would probably put you over the 50% rating, I would think, which then puts you into priority group 1. So my message to any POW or Purple Heart recipient that's in a priority group 3, go get your claim fixed, for lack of a better word. So let's continue on with priority group 3. You were discharged for a disability that was caused by or got worse because of your active duty service, or you have a service-connected disability that was rated between 10 and 20% disabling, or you're awarded special eligibility classification under Title 38, benefits for individual disabilities by treatment or vocational rehabilitation. Priority group 4. We may assign you to priority group 4 if either of these descriptions are true. You are receiving VA aid in attendance or housebound benefits. You have received VA determination for being catastrophically disabled. So if you're catastrophic in this category, it means that they're not service connected, right? It's bad disabilities, but they're not service connectable. Priority Group 5. We may assign you to Priority Group 5 if any of these descriptions are true. You don't have a service-connected disability, or you have a one that's non-compensated, right? Service-connected disability that they've rated at 0. So either a 0% or you have none. And you have an annual income level that's below our adjusted income limits. So a 0% or not being service-connected at all, and you have a annual income that's below the adjusted income limits based on the zip code. So they go down to the zip code. Or you're receiving VA pension benefits. So if you're receiving VA pension, you would be into Group 5. Or you're eligible for Medicaid programs, Group 5. Priority Group 6. We may assign you to Priority Group 6 if any of these descriptions are true. You have a service-connected disability that they've rated at 0% disabling, or you were exposed to radiation during basically like A-bomb testing and during the occupation of Hiroshima and Nagasaki, or you participated in Project I don't know this one. Project 112. Maybe shed some light on that. I'm sure I could Google it. Participated in Project 112, SHAD. Or you served in the Republic of Vietnam between January 9th, 62 and May 7th, 75. Or you served in the Persian Gulf between August 2nd, 1990 and November 11th, 1998. Or you served on active duty at Camp Lejeune for at least 30 days between August 1st of 53 and December 31st of 87. Now, you'll notice this sounds a lot like a presumptive list, right? So the PACT Act opened up this medical care for individuals. So if you're not service-connected at all, and let's say you file a claim, right? You're filing a claim, or you haven't even filed a claim yet, and you need to get medical care, you can go to the VA and show them your whatever documentation you have that shows that you served in the Persian Gulf between August 2nd, 1990 and November 11th, 1998, or that you were in Vietnam between 62-75, or you were in Camp Lejeune 30 days between 53-87, and show them that proof and be able to get care from the VA, and they would put you in Priority Group 6. So, there's a couple more here on number 6. We may also assign you to this priority group, number 6, if you meet all of these requirements. You're currently or newly enrolled in VA healthcare, and you served in theater of combat operations after November 11th, 98, and you were discharged less than 10 years ago. So that's another qualifier to get into Priority Group 6. Priority Group 7. They may assign you to Priority Group 7 if both of these descriptions are true of you. Your gross household income is below the geographic adjusted income limits for where you live, and you agree to pay copays. Priority Group 8, this is the last one. We may assign you to Priority Group 8 if both of these descriptions are true of you. Your gross household income is above the VA income limits and geographically adjusted income limits for where you live, and you agree to copays. So here's the thing. If you're in a lower number priority group, it's better, right? So 1, a 2, what have you. So when you hear somebody say, man, the VA is taking forever, it takes me months to get an appointment, they're probably in a lower, it's either a specialty thing and there's just not a lot of availability. But if it's just general practitioner and you're trying to get in, and it's taken a long time, then you're probably a lower priority group. So check with the VA and find out what priority group you're in and make sure it meshes with what you're at. Look, no system's 100% proof, right? So they could stink it up. Maybe you should be in priority group 1, but for some reason they have you in some other priority group. So all of your appointments take forever to get and all that stuff. So just word for the wise, make sure, do your own due diligence and check in on it and ask them, what priority group am I in? And then you can cross-reference it and you should know, hey, look, no, I have a 80% rating. I should be in priority group 1 or what have you. So with that, thanks so much. I appreciate each and every one of you. Continue to share the information, thumbs up, subscribe, all that good stuff. And remember, if we don't take care of each other, something went wrong.